Hi, I'm Dr. Matthew Zires. I am a dermatologist in Columbus, Ohio, who specializes in atopic dermatitis and does clinical trials. Today, I want to talk to you briefly about the addition of a topical JAK inhibitor to our therapeutic armamentarium. And one of the things that's going to be important to talk to patients about with preparatory guidance is the boxed warning that is going to come with the medication. So if we don't talk to patients about this proactively, they're going to get that package insert, look at that box warning, call back your office and say, what in the world are you trying to do to me? Right. And so it's really important to understand where that box warning came from. So the topical JAK inhibitor ruxolitinib that came on the market recently has been available in an oral form for quite some time as a treatment for graft versus host disease and for myelodysplastic syndrome. And there are a number of other JAK inhibitors that are on the market as systemic agents for rheumatoid arthritis. And when JAK inhibitors are given orally, there's clearly an element of immunosuppression and an element of an increased risk of blood clotting. Now, the FDA, because there is some systemic absorption of topical ruxolitinib, and we know that that's about 6% of the topical drug gets absorbed, decided that it was going to put a boxed warning, or it was appropriate to put a boxed warning in the package insert that talks about the risks of immunosuppression and the risks of blood clotting and even sudden cardiovascular death and lymphoma. And when I talk to patients about this, what I explain to them is that those warnings are really being brought forward because the same medication is available as a pill, and when you take it as a pill, it does have some of those risks. But that we believe that because the amount of medication that gets absorbed when you put it on your skin is so low, that if those risks exist at all, whenever you use it as a topical, they are very, very minimal, and they are not things that, in my opinion, to prevent us from using this medication in patients whose atopic dermatitis has not been adequately controlled by traditional therapies that we've had for decades.